Hello everyone, my name is Michelle Roberts and I have designed this clinical teaching plan to improve effective depression screening. I have chosen this topic because I have identified that there is a need for effective depression screening and increased knowledge. So let's talk about some background information on depression as a mental disorder. As you can see from these statistics, depression does occur commonly, and as providers, we need to be able to recognize symptoms and screen appropriately. Again, these charts identify the frequency of patients that have self-reported having frequent mental distress and poor mental health days out of a 30-day time span. And as nursing staff, if we do not identify depression in patients, their overall state of health begins to decline. So we ask ourselves, why is depression frequently overlooked and undiagnosed? Well, we know that there's a number of reasons. There is a lack of physicians and facilities, especially those in small towns or rural areas, as in the one that I live in. Lack of support groups, lack of education, and still the overwhelming social stigma of depression as a mental health disorder. Who are the learners of this clinical teaching plan? They are the licensed staff of Dyersburg Healthcare and Rehabilitation. They are both Caucasian and African American, and their ages range from 21 to 60. They are both male and female. Their education, they are both LPN, ADN, and Bachelor Prepared RNs. Their experience level, some of them have less than a year, and some of them have more than 10 years of experience. English is the main language, and they are proficient in reading and writing skills. So the goal for this teaching plan is the licensed nursing staff at Dyersburg Healthcare and Rehabilitation will be able to demonstrate a 90% increase in knowledge and self-efficacy related to the care of patients with depression by the end of this educational presentation. I have listed 4 objectives I plan to cover. In the first objective, I would like them to be able to identify at least 3 depression screening tools. I would like them to be able to identify 5 symptoms of depression, demonstrate improved self-efficacy in the care of those with depression, and be able to identify depression in at least 4 simulated case studies. The method of instruction I have chosen is the use of a PowerPoint presentation and case studies. In the article by Lenz and al., they stated that the use of a PowerPoint presentation helped to make the teaching very narrative and succinct, and it was a type of audience response system. In the article by Dutra, 2013, the use of case studies, they were scenario-based, and it took the focus off the instructor, and it was a learner-centered methodology of learning and teaching. In these next 4 slides, I will discuss the literature review and the methodology I've chosen to present the teaching plan. In this first article by Lenz and al., 2015, the title of this article was Practical Strategies for Effective Lecturers. It was a systematic review with a level of evidence 5. It discussed that PowerPoint presentation was an example of an audience response system. They advocated for the use of a PowerPoint presentation because it helped the instructor or the presenter to be able to succinctly summarize the slides. It helped to foster interactive learning, and they stated it was very effective for large groups because it helped to maintain the audience's attention. In this article entitled Educational Strategies for Teaching Evidence-Based Practice to Undergraduate Health Studies by Kriokoulis et al., it was a systematic review also with a level of evidence 3. It was a Medline database search. They searched 20 different articles were reviewed about medical students, nurses, and other students such as those in physical therapy programs. And the conclusion of this study was that a PowerPoint presentation was considered a multifaceted approach. In this article by Dutra, 2013, the article entitled Implementation of Case Studies in Undergraduate Didactic Nursing Courses. This was a qualitative study. It had a level of evidence of 5. It was a multi-site design study. And the study and purpose of this article was to determine if case studies were in fact implemented in courses. And what they did is they did a pre and post observational interviews. And that they concluded that the use of case studies removed the focus from the instructor, and it became a learner-centered methodology. And in the last article that I reviewed by Popel, 2011, entitled Promotion of Critical Thinking by Using Case Studies as a Teaching Method. This also was a systematic review with a level evidence 3. It was a study that covered CINAHL and Medline databases. Conclusion of this study was that case studies did promote active learning. It helped the learner better understand complex issues, and it was beneficial to the teachers as well. All right, in these next 2 slides, I'll discuss a synopsis of literature review. Both articles by Lenz et al. And Kriokoulis et al. Pointed out commonalities of using PowerPoints as a teaching method. Both articles agreed on the positive aspects of using PowerPoint. I did not find any differences in both of these articles. And both of these articles did agree that PowerPoint was an effective method of learning because it promoted engagement in learning. In these 2 articles by Dutra and Popel on case studies as a methodology approach, both of these authors agreed that using case studies was an effective method of teaching. I didn't find, again, any differences in these articles, and both agreed that case studies did promote active learning. The chosen method of teaching using PowerPoint and case studies fit in with my personal philosophy of teaching. The connectivism learning theory by George Simons, because both PowerPoint presentation and case studies were an example of multifaceted learning. Connectivism learning theory incorporates diverse learning, the need for continual learning, and encourages the learner, as does the PowerPoint and the use of case studies. The article by Kriokoulis et al. Discusses why the use of PowerPoint has been successful as a teaching method. And in this article, this was a systematic review. It covered 9 studies. And evidence revealed from this article that case studies was, in fact, a multifaceted approach and an approach that was best suited for teaching. And in the article by Dutra of 2013, it revealed in their article that case study was a successful methodology for teaching. It was a qualitative study, and it revealed that the use of case studies did, in fact, increase understanding, their competency level of the nurses, and critical thinking, and their overall long-term recall of information. And in these next 4 slides is an example of an outline of my clinical teaching plan. It lists objectives, the content, methods of instruction, time frame, resources, and evaluation methods. And in this clinical teaching plan, I am covering a total of 8 objectives. Okay, and in this slide, this is an evaluation for the learner to determine the effectiveness of this clinical teaching plan. And by use of this evaluation, this will also help determine if, in fact, that they did understand all the objectives that I wanted to cover. Here is another example of an evaluation for the learner. And the purpose of this evaluation was to evaluate the presentation itself and the style of the presentation. There's many different types of evaluations. This is a 2-page evaluation that I made up myself. I tried to make it just very simple for the learner to be able to answer the questions appropriately about the presentation. Here is a list of some additional resources I have included. And here are my resources and references. Thank you. Hope you enjoyed this clinical teaching plan about improving the effective screening for depression.